Start. So, ladies and gentlemen, good morning. My name is Kamel Ketari. I am the manager and the co-founder of the company Medinfo. Medinfo is a company belonging to GPI Group. Medinfo is a software editor company specialized in the field of software for blood transfusion, cell therapy, and solid organs. With more than 40 years developing software in close partnership with transfusion and transplant professionals, we are the most experienced company in our fields. Our software provides the best level of safety and full traceability of transfusion and transplant activities. In the 80s, the success of our software in France, in Spain, and in Germany led to the creation of different versions of Hematos. We quickly realized that maintaining different versions of the software for different countries was not an option. Thus, we decided to rewrite from scratch Hematos, developing a new software equipped with configuration module so powerful that it could meet the specificity of any customer worldwide without any need for code development. We have reached this objective 15 years ago, and we have now more than 200 sites worldwide using the exact same software with different configuration stored in the database. The configuration module is so powerful that it can adapt to local regulation and user-owned procedure without any code modification. This configuration module also provides an unequaled flexibility, allowing to modify the behavior of the software without delay and without any additional cost. Since then, we have continued to adapt the software to new technology and to expand the possibilities of the configuration modules. Our collaboration with the most advanced blood transfusion center worldwide enriched and continue to enriching Hematos with new functionalities, expanding its coverage. It enables us to anticipate future needs so that our customer always find in the system capability the answer to their needs. Recently, Medinfo released Hematos, which is the web version of Hematos. Hematos had the exact same feature as Hematos, but it is now open to many more possibilities thanks to the web technology. Hematos is now the most powerful software for the management of transfusion and transplant activity with the best level of safety, the highest flexibility, and the most recent technologies. Medinfo aims at always provide the best to each customer, and thanks to our customer satisfaction-oriented policy, our customers are loyal. Our oldest customer use Hematos since 1985. This means since 35 years. This loyalty leads our customer to renew their confidence in Hematos every time they have to make a decision. We are very happy to welcome Dr. Merenkov, who illustrates perfectly this renewed confidence and whose collaboration enriched Hematos. We have with us Mr. Slim Ketari from Medinfo. Mr. Slim Ketari worked long time with Dr. Merenkov, so I propose to Slim to start the discussion with Dr. Merenkov.
Dr. Merenkov, good morning.
Good morning from Chicago. Pleasure to have us international meeting.
Thank you for attending this meeting. So first of all, I will present you to the audience. So you are a medical doctor who graduated from the Northwestern University of Chicago in the United States. You have multiple decades of medical and technical expertise in transfusion medicine, particularly in the Arabian Gulf region. Your hard work and experience led you to obtain the highest distinctions during your studies and then the Star of Excellence Award twice. You are also passionate about IT, and you have valuable experience with laboratory information system and blood bank system. So I will ask you a first question. Your first contact with Medinfo was back in 2007. At that time, you were working for the Saudi National Guard as head of the division Transfusion Medicine and Laboratory Computer System. Doctor, could you please tell us what caught your attention when you first discovered Hematos?
Well, many hospital organizations I've worked with want one solution across all areas. But at that's a very great compromise. And honestly, it's too much of a compromise for transfusion medicine, both donor and for patient. My philosophy has been is you start with a model, and then you have to customize it to local requirements. The other systems were turnkey, and they just didn't permit the customization, which I think was optimal for the operations. What really intrigued me about Medinfo is that Medinfo is so customizable. If you know what you want to do, for the most part, you can do it. And that made my life very, very much easier. I really was impressed with the rules-based operations. I'm impressed that you have one framework of software and you have local parameters at each site that optimize it for that organization. So I was very happy that with our operation in the Middle East, which followed the Council of Europe type accreditation, that we could readily adapt it to our needs. And the same applied later when I had it in Qatar. It was very easy to customize it. And I said it was just the most important thing is the idea of knowing that you have a company you can depend on, and I can ask you questions about functionality, and you can honestly tell me if you can do it or not. Most other vendors I have not had that experience with. And so I can honestly say, in our relationship of more than 10 years, 13 years or so, that whenever I asked you if I could do something, you could tell me, and you never misled me. I wish other vendors would have done the same.
Thank you very much. It is really nice to hear when you're working for a company to hear so. Now I want to make a leap back in the past with you. So in 2008, working for the Saudi National Guard, you selected Hematos to manage the transfusion and laboratory activities. Your confidence in Hematos was then renewed in 2011 when you became the division head of transfusion medicine, blood bank and laboratory information system at Hamad Medical Corporation in Qatar. Please tell us which were the most important factors that led you to choose Hematos when you had to select a software.
I'm saying is that first we had not just the transfusion service, the patient side, we had the donor side. Mm-hmm. And in the National Guard in my time, we also had the stem cell module. So we had one system that was very intricate, complex, but worked across all aspects of my operations. I look at your software as whenever I show it, and actually I was just showing it yesterday at another meeting, I said, we have a full cockpit. We have all of the essential information I need as a transfusion physician and also as a systems analyst for the working of the operation on one screen. And very simply, I can gain any other piece of information. The operations in Qatar and Saudi Arabia were based on totally different production methods. And yet, it was not difficult to adapt the software from one version to another. The key thing is just knowing what you want and what you need and to organize yourself well. And I must admit, I've had several softwares installed outside of blood bank in my time, in the National Guard and in Qatar. No one did the extensive mapping of the processes that you did. You took ours, which I tried to make them detailed, but you really studied them, analyzed them, and together we optimized them. I have never had other vendor which would do that with me. That's what really is the essence. And that's why I'm so happy. I could never think of using another software for anything in transfusion medicine. That's honest. I'm not plugging. I'm not part of the Medinfo organization or GPI. But I'm just saying, as an end user, I am very, very pleased that I could build my vision. And unlike other softwares, blood bank is very dynamic. We keep changing and adjusting with COVID, with SARS, with Zika, with chikungunya, whatever the agent was. We had to constantly update and make adjustments and changes in production methods. All these things I could do. We could work together, you and I, Medinfo and myself, and bring these to completion in record time. Now make the comment: the COVID, 2 weeks from the time I gave you my specifications, you had it ready. Ask anyone else if they had what we did in those 2 weeks. No, I don't know anyone else who would be able to do that feat except you.
Thank you, doctor. So Hematos is a software that is dedicated to safety and traceability of the blood transfusion process activities, so from donor to patients, and also for transplant and stem cell therapy. Dr. Zaid, could you please explain us what is the added value brought by Hematos regarding to the patient?
The most important thing, human beings are not consistent, okay? But Medinfo enforces a consistency. Medinfo, there are no exceptions. If you, for the most part, for my staff, it forced my staff and forces my staff to do things in a methodical way in the order that we built. This is very anti-human. And they complain. I don't like this, I have to, but they adjust it. And as a result, we get a consistency in our processes that you could never do manual. No manual process can be enforced the way we can enforce things in Medinfo. And we can set rules. I can set many levels of rules if necessary. You have a lot, I could nest many sets of rules. But the most important, it forces my staff to do things in consistent ways. Production-wise, I can set the parameters for our automated component processing, and you enforce them. And that's what's most important. And only very few people can override that. So I have very good security, but I think there's no way I could achieve good manufacturing process as well as I could without your system.
Okay, and so you mean that doing things properly as planned increased the safety for patient side? Is that correct?
Exactly. Is that there's a consistent way of doing things, and you have to do it in the proper order, and you cannot do shortcuts. Medinfo is, I call it the unmerciful, and I'm very happy it's unmerciful because this is what gives us the safety in blood banking. But when people first learn it, they find it difficult because they're not used to doing that. But eventually, they adjust. And that includes all the transfusion practices. We set criteria for what the allocation rules, what type of component. You can't give a Kel positive unit or a Kel untested unit to a patient who has anti-Kel. We can set all sorts of rules, and they're enforced, and that makes things much safer. And I don't know of any other system which can make such sets of rules to be enforced like we can in Medinfo.
So you were talking about your staff. at Medinfo, we have an additional concern, which is developing software that is user-friendly and valuable. Could you please tell us what is the benefit of Hematos for the staff of your transfusion facilities? Donor and
For our donor and transfusion facilities, I have people that speak at least 10 different primary languages. Medinfo is written in Unicode, so certain aspects of our processes like donor questioning and registration can be done in another language seamlessly without any problem. The naming of the functions, the organization of functions, my staff, none of whom, for the most part, none of whom are native in English except myself, learned, and they could perform consistently. It was very well engineered. It's very well organized. It's written in international English if we want it. I know other clients may not be using English, but in the Middle East, English is the only thing that binds. On the other hand, for the donor situation, we do need Arabic, and the government requires that various reports and things be done in Arabic, and I can do it seamlessly. I can switch back and forth, and I can have other languages. So I'm saying is that this is very important. How can you be in a country when the native language is not supported by the software? I can name vendors who have that situation, but this is very suboptimal. I don't have that problem with Medinfo. That's the beauty of the structure, the Unicode. I can use any language I need or want, and this facilitates the operation.
So, doctor, you're working in a field, the blood transfusion, which is very specific within the medicine, and the Medinfo staff is trained to have the required knowledge to understand the expectation of our customers and assist them efficiently in the configuration work. Would you please share with us the approach used when installing Hematos and your evaluation of this approach?
Okay. Hematos sent specialists for different areas of functionality. There were several different people for the donor center, another set for the stem cell, and then for the patient. What impressed me, even though your staff were not specifically practicing transfusion medicine technical people, you understood the processes. And you studied our processes and helped us to improve our processes, and then you built it. And what I really liked was the fact that this is somewhat trial and error, because when we're making some major changes to our operations, we need to do testing on that. And we work together. I set up a group of super users who learned the system at the same time from scratch as the system was built. And together we tested, and those people became like local systems administrators and could take care of a lot of the problems. The Medinfo staff who came, I have no complaints whatsoever. They knew their fields, and we had no problem with communication, and it was a beautiful, for every part you had a person that was well endowed with knowledge in that particular area, and we built it, and we learned together, and I got my staff trained. So in the end, I had 16 super users who were trained for various parts of the operation and could do a lot of the troubleshooting, and they did the validations on our side. I say also your staff, very important thing, did your validation before you gave it to my staff for my validation. And I never found a problem with your validation. Your validation, we never had any major unanticipated problems. And this is remarkable, because I've worked with other vendors when I was at both of those sites, and I constantly had problems. But I never had that with the Medinfo team. And you didn't force us to use the default settings. In Medinfo, I don't know if there really are default settings. You have some templates and models of settings, and but you didn't force the same thing across everything, the same settings. And that much I appreciated. So my staff who are actually technically involved and medically involved and the nursing involved could work with you, and we can optimize the parameters to build the system.
So to answer your guess, you are right, there is no standard settings, and each setting in our customer facility is different from one to another. Obviously, we never start from scratch configuring the software, so usually we try to find some settings in one of our other customers that is more or less similar to what we expect in the new installation, and we always adapt to the requirements of the customer, making the workflows of the different operations and adapting to make sure that it fits perfectly. So you are right, there is no standard settings in Medinfo products.
Actually, that scares a lot of people, particularly here in North America, because they're always used to a turnkey system. They expect all the major decisions to be made for them. Well, I wish that things in life, everything could be made for me, but that's not how life works, especially in a blood bank. So the key thing was you really have to know what you want, but you have to be careful. I always tell my staff, be careful what you ask for. You might get it. And so you really have to think, and you'll make mistakes. I've made mistakes. We sometimes went down one set of process, and then we found that it just wasn't right, and we started. But your people were very understanding. You didn't charge us extra money to rebuild that line of reasoning and process. Other systems, it was one shot. You did it this way, that's all you get. If you want more, you have to pay more. But we had a very good working relationship. We understood each other. We knew that it would take some time to optimize it in the best way. And some of our assumptions might not always be right. And then we would go back and work together to optimize it. So it was a good learning process on both sides, and I think it was enjoyable. My staff who were involved with the building of Medinfo and those who are now my super users and work on the modifications. I think they're very, very pleased with it because we do get what we want in the long run.
Okay, I suggest we talk a little bit about evolution. So another requirement of your activity is the evolution of the software to be able to meet the latest best practices and technologies. Would you say that Hematos succeeded in anticipating your needs, and for the specific needs that required software development, how would you qualify the reactivity of Medinfo?
Well, I'm saying is that every morning, the first thing I was doing was to look at different international standards, different societies, the American Association of Blood Bank, ISBT, some national organizations, and see if anything had changed since last night. And I can guarantee you there was at least one change every week on average throughout my time in using your software. But I could very quickly dynamically update. If the criteria were changed for SARS or for Zika or whatever else, I could get a set of specifications to your local Medinfo engineer, either in Saudi Arabia or in Qatar, and we could, for the most part, have the modification ready for testing within 1 day. And I'm saying is that's very dynamic. COVID-19, to build an entirely parallel system, quarantine blood bank, quarantine collection, quarantine registration, collection, processing, the interdepot transfer, and finally the release, all set up in quarantine, sort of a parallel universe. And this we had functional in less than 2 weeks. And I'm saying is that we were one of the first places, I think by the first week in March or so, we had your system up and running. And so we were one of the first places that was collecting significant amounts of COVID-19 plasma. And that is remarkable. Also, I could say is that the processing is very dynamic. We were the first site in the world to use the Mirasol riboflavin-based pathogen inactivation together with automated blood component processing. First, it was the Atrius, and then later it was the Revios. And you worked with the vendor engineers and my staff, myself, and we were able to set up the world's first functioning bidirectional interfaces for these materials, as well as with the pathogen inactivation aerosol. We had those things running in less than a month. There are vendors I know which worked on this for many months and they were not successful. So this is remarkable. I put a lot of faith in you because I knew what you'd done for me in Riyadh. We made these world first interfaces, and the vendor for these equipment are always bringing staff to our hospital to show them how effective these interfaces are. So I'm very, very pleased. Blood bank is not static. I'll give you this statement. This is an anecdote from 3 days ago. One of my former staff on the non-blood bank part, systems administrator for a monolithic computer system covering all major parts of the hospital, pharmacy and nursing and laboratory and radiology and dental, have a laboratory module. The laboratory module, the blood bank module, I did not like at all. But they're saying is, why do you worry? The system is completed. You don't have to do any more with the blood bank system. And I said, I don't want you as a systems administrator for blood bank because you don't understand the dynamic nature of blood bank. Nothing stays the same. It's like the Heraclitus stepping in the river. Is it the same water that passes across his feet? No, it's always changing. And I can adapt it. I don't like to make change for change's sake, but when I have to because the regulations change, I don't have to worry that very quickly. I brought some changes up in actually in 1 day from start to finish. Some relatively minor, but who else could do that? I don't know any other vendor could respond so quickly, and that's all because you're so parameter based. The other vendor for the hospital system, we have to hard code it. And I said, how many lifetimes do I have to go through before you're going to be finished with the hard coding? Because they don't have an equivalent structure to yours. That's the elegance of your system, is the framework. So I can customize as I need, and I don't have to perturb the main system. The other thing I like is the fact I don't need middleware. And other parts of the laboratory are in shock. Why don't you use middleware? I said, Medinfo has the functionality built in it. Why should I add another layer that makes it even more complicated to keep everything current? Because there's going to be inconsistencies and problems brought in by the middleware. So all of our instrumentation, we have no middleware whatsoever using Medinfo, including for those world's first interfaces. We could set the truth table, the parameters, whatever, and it worked. And I said, and this is remarkable. I don't know anyone else who could accomplish that.
Thank you, Doctor. There are some head of transfusion facilities that are probably looking at this video. What advice would you give to them when it comes to selecting the software for their own activities?
First, know thyself. What are you really doing? Do you really know what your system is doing? Do you have a good manual system? The backbone of a good computer system is a good manual system. The good manual system can be improved by the consistencies and the rules which are enforced by the blood bank computer system. Do alternate software vendors offer you the same flexibility about interfacing equipment? Right now, I think all the major blood bank equipment that's out there has already been interfaced with Medinfo, and they're functioning sites. There's no, it's not that it will come, but it's already here. But you have to know what you're doing. And I've seen too many sites, they do not have a good, they don't have a good flow chart or series of flow charts of what they do. And if you notice on my LinkedIn and in my website, I have given examples of flowcharts we have used to show that everything has been mapped out. I could say every single process in Medinfo has been mapped out. We have truth tables. Everything is up front. So these are the things, when I give a set of specifications to your engineers, local or in France, you come back to me with the flow. I study the flow and see if we need to adjust it a bit. And then you build it. And I'm saying is that then I have that. So when I have international inspection and say, here are the tests, these are the processes in the computer system, and I can show them the validations based on those things. And very few people have that kind of a validation process and can show that everything has been mapped out. This is critical. So I know most people are afraid of flowcharts, doctors. Most people are afraid of blood bank doctors, but transfusion medicine doctors, you have to know what you're doing. And if you don't, you have to get outside help to help you understand what you're doing. Medinfo can help you a lot because they have all sites in many parts of the world, and they can suggest solutions to similar situations. But it's your decision. If you don't know, ask. I would never do anything unless I'm comfortable with it, and I would make certain I had the expertise in my organization or get external expertise to do it. So that's it. Know thyself and improve thyself. And then it works fine. But this is not a fast process. This takes time. It takes months to build an entire system. And as I scare the doctors and the administrations and hospitals, blood bank is fire. Playing with blood bank software is fire. If you don't do it right, you're going to get burned. The other analogy I use is a sword. You're walking on the edge of a sword. If you go off a little to either side, you're going to cut yourself, or even maybe slice yourself. So I'm saying is that this is what is most important. You need to know what you're doing. You should study your processes. Are you meeting your accreditation standards or your local or whatever else that you have to do? And then look at where your deficiencies are and what you're doing, and see how the system could build it. And I said that I found that in all the locations I have used your system, I have been able to follow the local regulations and all the international accreditation standards that those places follow. I want to make another statement on this, is that Medinfo's use of ISPT specimen labels and the fact that with the specimen labels, the final ISPT product label is a mark of excellence, that you actually met all your standards from the time the donor walked through the door to the time the production was done. Everything is there. Medinfo is not an ISPT label program. In the United States, there are many places. If you go to the ABB meeting, you'll see a lot of places that are selling you ISPT label makers. Put the code in, it prints it. I said, I'm afraid. I don't want ISPT labels to be printed on the fly. They have to be tightly controlled, and they are. And in your system, you also ensure that we check several times before attaching the final ISPT label. And I said, United States is maybe not as accustomed to ISPT as Europeans, but it's now a requirement in the United States. But still, people are forcing, want to use pre-printed labels, which for the most part in Medinfo, this is very tightly controlled. It must be controlled for security's sake.
Thank you very much, Doctor. So to conclude, could you give us your general feedback about your collaboration with Medinfo?
Medinfo has allowed me to aspire to things I could never have done without it. It has helped me to try to build a more optimal system for patient care, because that's what's most important. It enforces integrity of my system. It enforces consistency. All human traits that most people do not have, myself included. So it forces me to do things in a consistent way, and I can build rules to improve patient care, to ensure that a patient with certain diagnoses at certain locations can get a specific blood component, and it enforces these rules. And that's what's most important. Makes it much more difficult for a mistake to be made. And that's what I appreciate. And in our 13-year, we're right now into the 14th year journey that we've worked together, it has been a very positive experience. But it is a difficult experience and takes a lot of time. But It's necessary evil. If you're a blood bank medical director or transfusion service director, you have to have consistency, and you have to enforce your rules. So you have to study and know what you're doing. You should never do something without knowing why you do it. That's the most essential thing in blood bank. I don't want any of my staff to take any actions until they know why they do each step in the process. And Medinfo forces me to do that.
Thank you very much, Dr. Mirenkov, for sharing with us your experience and expertise. It's a real honor for us to collaborate with you and create together the new technology leaps for the safety in blood transfusion activities and donor activities. Thank you so much for your time. See you.
Thank you, Dr. Zaid, for this feedback, and thank you for all these years of collaboration. I was honored to work with you, and during all these years, our main aims was to provide you the best customer service and to provide and to get your entire satisfaction. And I hope we will continue working with you on new experiences and to provide you high level quality services. Thank you so much.
And I thank you for the opportunity to have exposure to your software. When I first saw it at my senior transfusion management team in Riyadh, they said, this is a dream. This is like nothing else we've ever seen. We can actually visualize that we can do what we want to do in your system, and no one else could do it. And it was a complete solution. And it really has been all throughout my time. I'm very excited about the web-based interface, and that the future directions and the newer equipment and processes that are going to be coming to donor, and new testing methodologies on the patient side will be very well achieved in the Medinfo system. And I look forward to continuing our long relationship. And I thank you for the opportunity to speak on these matters.
Thank you very much.